and welcome to this week's health hack. You're here with me, Jinelle and Matt, our pharmacist at Lloyds Pharmacy, and this week we're going to be going through some simple first aid hacks to help you and your family with minor accidents and injuries at home.
Hi Jinelle, yes that's right. Now from sprains to burns we know that accidents do happen, and for when they do we need to be prepared with some of the basic skills and essentials.
It's always best to be prepared, isn't it? Especially as we know there are some household injuries you just can't avoid. For example, a sprained ankle. So how would we treat a sprain at home, Matt?
So when it comes to sprains, they're most common in the ankles, in the wrists, in the thumbs and in the knees as well. And most of them you can treat them yourself rather than going to the GP. For pain relief, the first line will be paracetamol. And after that, for the first couple of days, you should always undergo R.I.C.E therapy, which will help to reduce the swelling.
What does R.I.C.E stand for?
Start with R for rest, so stop any exercise and try not to put any weight on the injury. I is for ice pack, which should be applied to the sprain for 20 minutes at least every 2 to 3 hours. C is compression, so very simply put a bandage around the affected injury. And E, you're looking at elevate, so in the case of a sprained ankle, keep it elevated on a pillow or a cushion for as long as possible.
That gives R.I.C.E a whole new meaning, Matt. Some really great, memorable advice there, thank you. Another really common household injury are burns. So what do we need to remember when treating burns?
So as soon as you've experienced a burn, make sure you hold it under running water, whether that's cool or lukewarm water, for at least 20 minutes. You can remove any clothing or jewellery from around the burn, but make sure that you don't if it's holding the skin itself. Make sure you put over a layer of clingfilm over the injury, but not wrapping it around the limb. In the case of a burn to the hand, you can use a clean, clear plastic bag. When it comes to pain relief, you shouldn't apply creams, lotions or sprays to the burnt skin, but instead for pain relief you should take ibuprofen or paracetamol.
Is that relevant for all burns?
Well, different burns will have different treatments. So for instance, if you've got an electrical burn, you should always go straight to A&E. For chemical burns, the most important part is to treat it using protective gloves. The impacted clothing should be removed and the burn rinsed with cool running water for at least 20 minutes to remove the chemical. The most important part is to remain calm, and if you need any further advice, you can call NHS 111.
So I think we can all agree that it's really important to stay calm during a crisis. No matter whether you're the patient or you're trying to help someone else.
Definitely. In the moment, it's really important to think about what the best action or treatment is, whether that's for you or for a loved one. Try not to panic. Now, being prepared with some of the basic first aid essentials helps you to react quickly in this situation.
So just on that, what first aid essentials are important to keep stocked up at all times?
So I'd say it's a good idea to keep all of your first aid supplies in the house in a medicines box. So you should include items such as plasters, bandages, scissors, as well as alcohol-free cleansing wipes and a cream for dealing with insect bites and stings. You can also keep an antiseptic cream at hand, as well as for children, paracetamol and ibuprofen. Keep the medicines box out of reach of children at all times, and also make sure you're frequently checking the medication within the box for its expiry dates. If you don't have a medicines box yourself, you can come down to Lloyds Pharmacy for a limited time and spend at least £20 on some of our own brand products, including those I've just mentioned, and you'll get a free medicines box as well.
Oh, thanks Matt, I might have to pop in and get one myself. Guys, as always, comment below with any questions that you have for us, and we'll see you for next week's health hack.